Hello everyone, welcome back to Codement Mastery. In today's video, we are going to solve some questions from the ICD 10 CM. This is very important for your CPC exam preparation in 2025. So let's start with the first question. Before that, don't forget to hit the like button, share this video with your fellow coders and also subscribe to my channel. This is the first question. Patient admitted to home health for IV antibiotics. The documentation states the patient has septicemia related to an infected surgical wound. The coder should: option A, code sepsis since septicemia is not a term in ICD-10. B, query the physician for clarification. Option C, ask the assessing clinician if septicemia should be coded. And option D, only code the infected surgical wound. So what is the right answer for this question? The right answer for this question is option B, query the physician for clarification. The term septicemia is not specifically used in ICD-10 and it can be interpreted differently by clinicians. For accuracy, ICD-10 coding requires clarity on whether the condition refers to sepsis or other related diagnosis. Therefore, querying the physician ensures precise documentation and coding to reflect the patient's condition accurately. Therefore, the right answer is option B. Next question. Sequela describes a condition that is: option A, combination of two or more diseases. Option B, late effect of a previous condition. Option C, manifestation of an underlying etiology. Option D, not represented in the ICD-10. The correct answer is option B, late effect of a previous condition. A sequela refers to condition that arises as a result of prior illness or injury. For example, a stroke might lead to long-term sequela like hemiplegia, that is partial paralysis. This concept is crucial in medical coding as sequelae often require specific coding to capture both the original condition and its lasting effects accurately. Next question. Surgical aftercare codes, option A, are generally first listed and explain the reason for the encounter. Option B, only one aftercare code may be listed per claim. Option C, aftercare codes are conditions the patient has had in the past but no longer exist. Option D, aftercare codes do not exist in ICD-10 and the acute code should be listed with a 7th character describing the encounter. The correct answer is option A. That is, surgical aftercare codes are generally first listed and explain the reason for the encounter. In ICD-10 CM coding, surgical aftercare codes are typically used to explain the purpose of the encounter following surgery. They are listed as the primary reason for the visit when the focus is on recovery or follow-up care after the procedure, rather than managing the underlying condition itself. Next question. Heart failure due to rheumatic heart disease is coded to: option A, I50.9, option B, I50.1, option C, I09.81 and option D, I50.20. Check all these four codes. The code in option A, I50.9, is for heart failure unspecified and I50.1 is for left ventricular failure unspecified. And the code in option C, I09.81, is for rheumatic heart failure, and the code in option D, I50.20, is for unspecified systolic congestive heart failure. In the question, they have given rheumatic heart disease. Therefore, the right code is I09.81 because it specifically represents rheumatic heart failure, which is heart failure resulting from a rheumatic heart disease. Next question. According to ICD-10 guidelines, how is the postpartum period described? The correct answer is option A. The postpartum period begins immediately after delivery and continues for 6 weeks following delivery. You can find this definition in your ICD-10 CM manual, chapter 15, Pregnancy, Childbirth and the Puerperium. In that, below the title, Peripartum and Postpartum Periods, you can find the definition. The postpartum period begins immediately after delivery and continues for 6 weeks following delivery. You can highlight this. So that's it for today. Thanks for watching. I will see you in the next video.